If you move that neck, you risk permanent paralysis before you even start saving a life. We have a 25-year-old male, high-speed motorcycle crash, unresponsive on the gurney. He's gurgling, his saturations are dropping, and the team is reaching for the chin lift. Stop. In major trauma, you never tilt the head. You have to assume that C-spine is fractured until proven otherwise. I need an assistant stabilizing the neck in a neutral position immediately while I clear the airway. Look inside, there's blood and vomit. If he keeps aspirating, he's dead. We tilt the entire trolley head down to let gravity help, and use the Youngcower for the liquids and McGill forceps for the solids. Never sweep blindly, you'll just push the obstruction deeper. Now the jaw thrust. Lift the mandible forward from the angles. It's the only way to pull that tongue off the back of the throat without moving the spine. Listen to me carefully, because this clinical rule is the line between life and death. If your trauma patient is responding only to pain on the AVPU scale, or their GCS is 8 or less, they have lost the ability to protect their own airway. At this level of consciousness, an advanced airway is no longer an option. It is a mandatory, immediate priority. Since he's not fighting me, I'm sliding in an oropharyngeal airway to bridge him, measured from the incisors to the angle of the jaw. If he fought the OPA, I'd check for basilar skull fractures and consider an NPA, but his lack of gag reflex is our red flag. Get him on 15 liters of high-flow oxygen via a non-rebreather. He's still hyperventilating. We need the bag valve mask. 2-person technique only, one to seal, one to bag, to ensure we aren't losing pressure. But remember, if you are at the stage where you're bagging a trauma patient, you need to be preparing for a definitive airway right now. Prepare the team now. Intubate before he crashes. The key lessons here are simple. First, it is manual inline stabilization with a jaw thrust only, never a head tilt. Second, a GCS of 8 or less, or a patient responding only to pain means an advanced airway is mandatory. And finally, always use a 2-person BVM technique to maintain that neutral neck position while providing high-flow oxygen.